Masturbation after the age of 60. Could it have adverse effects on your health, particularly your prostate? Hello, gentlemen. I'm Dr. Marissa Blake, a board-certified urologist with over a decade of experience helping men over 60 take control of their prostate and intimate health with clarity, compassion, and no judgment. Today, I want to open a conversation that's rarely spoken out loud, but quietly lingers in the minds of millions of older men. Masturbation. After 60, is it still healthy? Is it silently harming your prostate, hormones, or your ability to connect with your partner? If you've ever wondered that, even once, let me assure you, you're not alone. Many men have sat across from me with the same quiet concern, unsure who to ask, afraid of the answer. And the truth is, most of the information out there is filled with outdated myths or silent shame. But not today. Today, we'll look at the full picture. 5 powerful benefits and 5 real risks of masturbation in your mature years. Let's begin. Why masturbation? After 60 is still a taboo topic. Let's be honest, for many men, talking about masturbation feels uncomfortable. It's not something discussed at family dinners or even during most doctor visits. Even in my clinic, it's often the last question a man dares to ask. His voice low, his eyes searching mine for reassurance. Why is that? Because for decades, society has whispered the same message, that after a certain age, men should be beyond this need. That self-pleasure is either embarrassing, unnecessary, or worse, harmful. Religious beliefs, cultural silence, and outdated medical opinions have all created a kind of invisible wall. A wall made of guilt, confusion, and quiet shame. But here's the truth. Masturbation isn't a sin. It isn't a weakness. And it certainly isn't something only young men do. It's a natural function of the male body. And like any function, its role changes with age. What matters is not whether you do it or not. What matters is how you do it and why. So let's move beyond the taboo, because what follows next might change the way you see your body and your health for the better. 5 proven benefits of masturbation. After 60, 1, it keeps your penis healthy, like exercise for your erection. Think of your penis as a muscular structure, not just an organ. Like your legs or arms, it relies on regular blood flow and stimulation to stay strong. Every erection is a mini workout. It fills the corpora cavernosa, the sponge-like tissues with blood, stretching and oxygenating them. This keeps the tissue elastic and healthy. Without regular erections, especially in older age, those tissues can stiffen, a condition known as penile fibrosis. That's when men begin to notice their erections aren't as firm or don't last as long. Masturbation acts like gentle physiotherapy. It maintains circulation, prevents internal scarring, and keeps the plumbing responsive. In short, use it or risk losing it. And this simple act, when done mindfully, may help you stay physically capable when the moment truly matters. 2. It protects your prostate from disease and inflammation. This one surprises many of my patients. Regular ejaculation may actually protect your prostate. In a landmark study by Harvard University, men who ejaculated at least 21 times per month had up to a 33% lower risk of developing prostate cancer compared to those who ejaculated only 4 times out of 7 times. Why? It comes down to detox. The prostate stores fluid, and over time, stagnant secretions can build up. Ejaculation acts like a cleanse, flushing out old cells, potential toxins, and reducing inflammation inside the gland. Think of it like taking out the trash. If you let it pile up, it starts to rot. But if you remove it regularly, the environment stays clean and functional. So yes, this natural release may be more than just satisfying. It may be one of your most powerful tools for long-term prostate health. 3. It strengthens your pelvic floor muscles. You've probably heard of Kegel exercises, usually in relation to women. But did you know they're equally important for men? The muscles at the base of your pelvis, especially the pubococcygeus muscle, are crucial for bladder control, sexual function, and even posture. Every time you orgasm, those muscles contract rhythmically. That's not just pleasure, it's exercise. Over time, this strengthens your pelvic floor, which helps with three essential functions. Firmer, longer-lasting erections by trapping blood in the penis. Better control over ejaculation, reducing or preventing urinary leaks and dribbles. It's a built-in workout for a part of the body that too many men ignore until it stops working. So the next time you climax, know this: you're not just enjoying a moment, you're building your foundation. 4. It helps you sleep better and lowers stress. As we get older, sleep becomes more elusive and stress levels often rise. But here's a quiet truth your body already knows. Ejaculation triggers a cascade of calming effects. After orgasm, your body releases oxytocin and prolactin, hormones that promote relaxation and connection. At the same time, levels of cortisol, the stress hormone, drop sharply. This shift in brain chemistry promotes deeper, more restorative sleep, lower blood pressure, a calmer nervous system, a reduced sense of anxiety or restlessness. So if you're tossing and turning at night, or feeling tense without a clear reason, this gentle act might be a better solution than another pill. Sometimes, the key to a better night's rest is already in your hands. 5. It keeps your desire and nerve pathways active. The biggest sex organ in your body? Your brain. Desire, arousal, and pleasure are all driven by a network of signals between your mind and your body. As we age, these circuits can start to quiet down, especially if they're not used regularly. Masturbation keeps those neural pathways active, responsive, and connected. It also helps maintain libido, even if you don't currently have a partner. And it's not just about wanting, it's about keeping your body ready and capable of responding. Many men are surprised to find that after months or years of ignoring this part of themselves, their arousal becomes sluggish or unresponsive. Regular stimulation, physical and mental, is like brushing the dust off a vital part of your identity. It keeps your body in touch with your desire and your desire in touch with your vitality. 5 risks of masturbation after 60 if done the wrong way. 1. It can lead to social withdrawal and emotional disconnection. Masturbation can be healthy, but when it starts replacing real human connection, it becomes a red flag. Some men retreat into this habit as a substitute for intimacy, especially after loss, divorce, or relationship struggles. Over time, it can lead to isolation. You might find yourself avoiding emotional closeness or losing interest in forming new bonds, even friendships. As a urologist, I've seen men whose lives became smaller, not because of age, but because this one habit became their main source of comfort. The solution isn't to stop completely, it's to ask yourself, is this helping me stay connected, or is it pushing me further into solitude? Masturbation should support your life, not replace the relationships that bring meaning to it. 2. It can cause skin irritation and micro tears. As we age, our skin becomes thinner, drier, and more delicate, especially in intimate areas. Frequent or aggressive masturbation without proper care can cause micro tears, irritation, and even small abrasions. These tiny injuries may not seem like much, but they can lead to inflammation, discomfort during urination, or even infection, especially if hygiene isn't ideal. If you've noticed burning, redness, or a raw sensation afterward, that's your body asking for a gentler touch. Simple fix: always use a water-based lubricant, especially if your natural lubrication has declined with age. And remember, this isn't a race. Slow, Relaxed, mindful stimulation is not only safer, it's often more pleasurable. 3. It can lead to desensitization. Over time. One of the most common complaints I hear from older men is, "I can only feel pleasure when I do it myself, not with my partner." This often happens because the body becomes conditioned to one very specific form of stimulation. Same rhythm, same grip, same angle. The brain and nervous system begin to associate that pattern as the only way to feel pleasure or climax. When it's time to connect with a partner, a softer touch, slower pace, more emotional experience, it might feel underwhelming or even numb. To avoid this, vary your technique. Change your hand, pressure, rhythm. Use your imagination instead of relying solely on visual content. The goal is to keep your body flexible, not just physically, but neurologically. 4. It might mask an underlying medical problem. Here's a subtle but serious risk. Some men can achieve an erection during masturbation, but not with a partner, and they assume everything's fine. But that's not always true. If you find you can only get aroused alone, but not in relational or emotional situations, it may be a sign of an underlying issue. Early-stage erectile dysfunction, circulation problems, low testosterone, performance anxiety, early signs of depression. Masturbation becomes a safe space, but it also hides what your body is struggling to tell you. If you've noticed this pattern, don't ignore it. Talk to your doctor. You deserve more than just solo relief. You deserve confidence in all areas of intimacy. 5. It can become a coping mechanism for stress or boredom. Let's face it, aging can bring emotional weight, loneliness, loss, regret, or anxiety. It's tempting to turn to masturbation as a quick escape, especially when you feel stressed, bored, or restless. But if it becomes your only way of calming down, you may start relying on it in ways that don't truly address the root of what you're feeling. Like food or alcohol, it can become a habit of emotional avoidance, not healing. Healthy coping means having multiple tools in your emotional toolbox: gentle movement or stretching, a call to a trusted friend, reading something uplifting, breathing, or prayer. Time outdoors. Masturbation can be part of your rhythm, but it shouldn't be the only thing holding you up when life feels heavy. 5 signs. You should talk to your doctor. Let's be clear, masturbation itself isn't the problem, but sometimes the body uses this private act to hide warning signs that should never be ignored. Here are 5 signs that it's time to speak with a professional. 1. You can only get an erection during masturbation, not with a partner. This could point to underlying vascular issues, performance anxiety, or low testosterone. It's not shameful. It's treatable. But only if you speak up. 2. You feel pain, pressure, or aching during or after ejaculation. A mild recurring discomfort might mean inflammation in the prostate, an infection, or even nerve tension in the pelvic floor. 3. You notice blood in your semen or urine. This doesn't always mean something serious, but it should never be ignored. It may indicate infection, an inflamed prostate, or something that needs closer investigation. 4. Your libido has vanished, and not just occasionally. If desire feels like a distant memory for weeks or months, it could be due to hormonal imbalances, chronic stress, or depression. 5. You've lost sensitivity in the genitals or feel numbness. This could be caused by nerve compression, often due to posture, cycling, or spinal issues. Remember, none of these signs mean you've done something wrong. They're just your body asking for attention, not judgment. And as your doctor, I want you to know, it's always okay to ask for help. How to turn masturbation into a gentle health ritual. By now, you've seen that masturbation isn't something to fear. But like anything in health, how you do it matters. Here's how to transform it from a secret habit into a simple, restorative practice for your well-being. 1. Choose the right time. Morning is often ideal. Testosterone levels are naturally higher, and the body is more relaxed. After a warm shower is another calming moment. 2. Set the tone, not just the act. This isn't about rushing or getting it over with. Treat it like a gentle self-care practice similar to stretching, meditating, or brushing your teeth with intention. 3. Use lubrication. Always. A water-based lubricant protects your skin, reduces friction, and allows for longer, more comfortable stimulation. 4. Focus on sensation, not speed. Slow down. Vary your rhythm. Pay attention to how your body responds. It's not a race, it's a conversation. 5. Consider combining with pelvic floor engagement. During climax, gently contract your lower abdominal and pelvic muscles. This strengthens the pelvic floor, the same muscles that support bladder control and erectile function. Over time, this becomes more than a release. It becomes a way of maintaining your body's balance, circulation, and confidence. You've just learned what most men never hear in a lifetime, that masturbation after 60 isn't something to hide from. It's not a moral failure. It's not a youthful indulgence. It's a natural part of male health, and when done mindfully, it can support your body, your prostate, and your emotional well-being. But as with all things, balance matters. Listen to your body. Watch for signs, and never be afraid to ask for help, because aging doesn't mean fading. It means choosing how you care for yourself with dignity, awareness, and self-respect. I'm Dr. Marissa Blake, and I hope this helped you feel just a little more at home in your body.